Welcome to Lesson 2. Today we're going to tackle something that's transforming how we work: generative artificial intelligence. Large language models like the ones powering today's AI assistants can help us scan vast amounts of literature, summarize community health assessments, and extract key themes from policy documents. But with this power comes responsibility. We need to understand both the capabilities and the limitations, and we need to use these tools ethically. Let's explore how to do this well. By the end of this lesson, you'll be able to accomplish three objectives. First, construct effective prompts for AI-assisted literature review. How you ask matters as much as what you ask. The quality of your prompt determines the quality of your output. Second, validate AI-generated outputs against primary sources. AI systems can make mistakes, sometimes confident-sounding mistakes. You must verify before relying on any AI output. And third, apply ethical principles to AI use in public health contexts. This includes privacy, equity, transparency, and accountability. Let's begin. Let's start with the problem we're trying to solve. Information overload is real. A community health assessment might be 300 pages. Thousands of research articles are published every week in health-related journals. Policy documents span multiple agencies at local, state, and federal levels. The honest truth: no one can read everything relevant to their work. We all make choices about what to focus on. Sometimes we miss important information simply because we didn't have time to find it. This is where AI can help, not by replacing human judgment, but by helping us navigate the flood of information more efficiently. So what can AI actually do for literature and policy scanning? It can summarize long documents quickly, feed it a 200-page report, and ask for the key findings. You'll get a usable summary in seconds. It can extract themes across multiple sources. What are the common barriers mentioned across these 10 community assessments? AI can identify patterns. It can spot connections you might miss when reading one document at a time. It can answer specific questions about documents. What does this policy say about eligibility requirements? What are the main recommendations in this report? And it can generate first drafts for human refinement. You might ask it to draft a summary of findings, then edit and improve what it produces. Getting good results from AI requires good prompts. This is called prompt engineering. First, be specific about what you want. Don't just say summarize this. Say identify the top 3 health priorities and the key barriers to addressing each. Provide context about your purpose and audience. I'm developing a community health program for low-income seniors. Gets better results than generic requests. Specify the format you want. Do you need bullet points, paragraphs, a table comparing options? Ask for reasoning and sources, not just conclusions. Why is this a priority? What evidence supports this recommendation? And iterate. Your first prompt rarely produces the perfect result. Look at what you get, then refine your prompt to get closer to what you need. Let me show you how specificity improves results with a concrete example. A basic prompt might be, summarize the health priorities in this assessment. You'll get something, but it may not be what you need. A better prompt: identify the top 3 health priorities, including supporting data and the populations most affected. Now you're getting more useful information. The best prompt is even more specific. Review this community health assessment. For each of the top 3 health priorities, provide the following: the health issue, prevalence data cited in the document, the populations most affected, and barriers to addressing this issue that are identified in the assessment. Format your response as a table. This prompt tells the AI exactly what you need and how you want it presented. Specificity drives quality. Now for the critical step that many people skip: validation. AI systems can hallucinate. That's the technical term for when they generate plausible sounding but false information. They might cite a study that doesn't exist. They might give you statistics that seem reasonable but are made up. They might confidently state something that's simply wrong. This means you must verify key facts against primary sources. When the AI says the community health assessment identifies diabetes as the top priority with a prevalence of 15%, go to the document and confirm that's what it actually says. Be especially careful with statistics and citations. These are where AI is most likely to make errors. Human in the loop is essential, not optional. AI is your assistant, not your replacement. You remain responsible for the accuracy of your work. Let's talk about ethics, starting with privacy. Never input protected health information into public AI systems. Those chatbots you access through a browser, they may store and use your inputs for training. That's fine for general questions, not fine for patient data or sensitive community information. Be cautious with identifiable community data. Even aggregated data can sometimes identify small populations. Think carefully about what you're sharing. Understand where your data goes when you use AI tools. Read the terms of service. Ask questions. Many organizations are developing enterprise AI solutions with appropriate data protections. When you're working with sensitive information, these may be the only appropriate option. Equity and bias are equally important considerations. AI systems reflect the biases present in their training data. If certain populations are underrepresented in the literature the AI was trained on, the AI's outputs will reflect that gap. This means AI might underrepresent marginalized communities in its analyses. It might echo mainstream perspectives while missing alternative viewpoints. It could perpetuate existing inequities in how we understand health problems. What do you do about this? Actively seek out perspectives the AI might miss. Don't rely solely on AI for equity-focused analysis. Bring in community voices, qualitative data, and lived experience that the AI cannot access. Think of AI as one input among many, not as the final word. Finally, transparency and accountability. Be transparent about when and how you use AI. If AI helped generate a document, say so. If AI assisted your literature review, disclose it. This is becoming an expectation in professional and academic contexts. Document your prompts and validation process. What did you ask? How did you verify the results? This documentation supports reproducibility and accountability. Take responsibility for outputs that bear your name. If you submit a report and the AI-generated content contains errors, those errors are your responsibility. You chose to include that content, and remember, AI is a tool. Humans remain accountable for decisions. When a program fails because it was based on faulty analysis, you can't blame the AI. The responsibility lies with the humans who used the AI and made the decisions. Let's summarize our key takeaways. AI can help manage the information overload inherent in needs assessment. It's a powerful tool for summarizing documents, extracting themes, and answering specific questions. Effective prompts are specific about content, context, and format. The quality of your prompt determines the quality of your output. Validation against primary sources is essential. AI systems can generate plausible but false information. Always verify before relying on AI outputs. Ethical use requires attention to privacy, equity, and transparency. Be thoughtful about what data you share, whose perspectives might be missing, and how transparent you are about AI use. And fundamentally, AI is a tool that augments human judgment, not a replacement for it. You remain responsible for the quality and ethics of your work. In our next lesson, we'll explore primary data collection with digital tools. Thank you.